We always have a declining cases after an outbreak. After a lockdown. So you can see a reduction in cases here after the mid-November cases in that lockdown, and then after Christmas Day we had the peak, and then we had the decrease in cases since that lockdown. Then across the 5 districts and boroughs, the area with the highest 7-day rolling average, which is the number of cases per 100,000 population, is North Warwickshire at 91.9, followed by Rugby at 70.7, Nuneaton, Bedworth, Stratford-upon-Avon, and Warwick at the bottom. The area with the highest number of cases is Nuneaton, Bedworth at 85, followed by Rugby, Stratford-upon-Avon, North Warwickshire and Warwick. Now, at one point for each district and borough, we're seeing sort of a good couple of hundred cases in each district and borough. So just to see these numbers across a district or borough is really good. Also, we're a bit more smug this week that we're the lowest of Coventry and Solihull. So we got 59.5, which is just below Coventry and a little bit below Solihull, slightly above the England average, but we're happy with that. It's all coming down, which is really great news. And then I tried to show everybody the data on cases. So the blue line is secondary schools, the orange line is primary schools, and the grey line is early year settings, which include childminders and nurseries. So as you can see here, across all September through to around sort of mid-December, we had like a rumbling around maybe one case, couple of cases, but really not that many cases. And then from mid-December onwards, the cases started to increase. We've gone slightly above 5 on this, but generally it stayed below 5 as a rolling average. So that's 5 cases per day, per 7 days, which it's, and it's come down a bit as the other cases came down. And strangely, even though schools have reopened, early years cases have come further down. I don't know if that's because children are less in early years. I just don't know the reason for that, but it's come down considerably, which is really good to see. And you can see here that in the last week, secondary schools are starting to increase again. Primary schools have kind of had their own peaks, followed secondary schools, then they followed the early year settings. So primary schools kind of followed the peaks of all of the settings going forward, which is really interesting to see. So as you can see, we're seeing an uptick, but we're not seeing it so much in the early settings, which is good to know. So I'll just stop sharing my screen now. So I'll jump onto the questions in the chat in a minute, but just talk through some of the things happening at this time. So as you all know, the areas are receiving test kits, home test kits. Now, you'll hear lots of terms being thrown around. There are LFTs and there are LFDs. What is the difference? So an LFT is a lateral flow test. And a lateral flow test is done in an asymptomatic test centre, your mass testing centres, which are in secondary schools and in community centres. Basically, it's like a test tube set. They swab someone who comes in, or sorry, the person swabs themselves, hands the person the swab. That person will put the swab into a test kit, like a test tube device, and then they will test in the test centre, which has got a lot more sort of chemicals and other setups. A LFD is a small plastic device that you take home with you. So you'll have a pack of 7 of them, and you'll take those at home as part of the home testing. So when we talk about LFTs, we're talking about tests in test centres. And when we're talking about LFDs, we're talking about the plastic cartridge that you have at home, which is like the pregnancy test kind of version. Now, if you do an LFT in a test centre, or a child does an LFT as a secondary school, or a staff member in a secondary school does a test, they do not need to do a PCR test to confirm that positive result. That LFT is entrenched in law and they must self-isolate. So if any of your staff at this time go off to any LFT centres in the community and test, they do not do a further PCR to confirm that result. They must isolate for the 10 days. That is written in law in this country at this time. If you do the LFD, which is a plastic device at home, and you get a positive test result, you must go and PCR confirm on the same day. So we recommend that when you do have all your LFDs at home and they arrive at your settings and you take them home and your staff start doing them at home, We recommend they do them as early as possible. The reason being is we need them, if they're positive, to be PCR tested the same day at a PCR centre, because they're a lot more sensitive than the plastic devices. However, as a setting, you will act on that LFD positive. So if a staff member calls you and says, my home device is tested with 2 lines, I'm now positive for COVID, I've just booked my COVID test at the PCR centre, you as a setting must self-isolate all of the close contacts of that staff member. And if they are found to be negative at the test centre, then they can then stop isolating immediately and go back to usual activity. So just to be aware of when I'm using terms and isolations, that's the ruling around the different isolations and setups. Now, just remind everybody that you can get support around finance, just to move on to another subject. So we do discuss finance quite a bit. A lot of settings are wondering about isolation funds that people can apply for. So if you've got any staff isolating or you want to see what other funds that you're eligible for, Jessica and the team can put that information in the chat and we can have that discussion and support you around anything around that. We are getting lots of queries around face coverings and face shields. So I'll just go over that guidance very, very quickly. So there's 3 types of face covering that you can have. There is a face covering which is fabric, which provides some protection. We don't know how much the types of material provide protection against transmission of COVID. There is a PPE, which is a fluid repellent medical face covering, which we don't recommend in any settings or schools at this time, but it's what they use in health and social care, and it's what they use in hospitals. And then finally, there is the face visors. Now, the face visors provide some protection against spittle coming the way that could be landing on the face or the eyes or in the nose. They can be used with a face covering, a fabric face covering, to provide extra protection. What I have seen though in some settings is they have the face visor, but it's actually above the nose and the mouth. So actually, if anyone is talking to them, because they're holding their head up, any spittle is coming underneath the mask, and so it provides absolutely no coverage whatsoever. So if you do want to use face visors, is to wear them down further over the nose and the mouth, and it is most to protect against the spittle that could be touched on the face or the eyes and passed into the nose and the mouth. It's better than nothing if people are not wearing masks. And people want to have that extra support, that, it does provide some support, because everyone, sometimes when you're speaking, you provide those little bits of fluid. So it is, if people want to wear them, they can, especially when they're working very close contact with people. But it's to be aware that you are not, you would still be classed as a close contact, even when you're wearing a visor. And if you're working within 2 meters of somebody, you'll still be classed as a close contact, even when you're wearing a face covering. So it's just to talk through some of those extra things. If you're dealing with children that are particularly, like to lick a lot or touch your skin or lick your skin, you can get sort of like capes which have got sleeves on them that can be cleaned or wiped down or single use, if you have got any particular staff that are particularly concerned about that. So just to kind of put that forward. We are still getting lots of questions about extremely clinically vulnerable staff or children in settings, and our statement at this time is that if you're a staff member, you should not be in work, and we are finding that most settings can't insure staff if they're extremely clinically vulnerable and they want to come into work. We're saying that they should not be in work, they should follow the shielding guidance. And any children that are extremely clinically vulnerable, we would not recommend them to be in the setting. It must only be in a situation with a discussion with us and the clinicians around that child, and only when really being at home is more detrimental to being in the setting. And that's really, really important that we're clear on that point around extremely clinically vulnerable children. Just to talk about, again, households. So we're still getting lots of queries around households. If you have a child in a family who tests positive, or a family member tests positive, the whole household only need to isolate from the first person in the house who develops symptoms. If anyone else in the household goes on to develop symptoms, say 2 days later, 7 days later, you don't then start the clock again. You go from that first person in the house. The only time we restart the clock again is if the child in your setting, say the one person develops symptoms, and the person in your setting develops symptoms, they would start the clock again for themselves from when their symptoms started. We wouldn't then get the whole household to isolate for another 10 days. It's just anyone who tests positive, we would ask them to isolate from the first day of symptoms or from when they tested positive. Other than that, you go from the very first person in the household who tests positive. The only time that that guidance gets extended is when, say, it's been 2 weeks. So from the first person tested positive, 2 weeks has passed, and then another person in the household then develops symptoms. It's likely that that's a new case. And as a result of that, we may isolate the whole setting again for those that haven't tested positive previously. Talking about vaccine, as always, even if you have staff who have been vaccinated, if there are close contacts, they still need to self-isolate. At this time, it doesn't matter whether you've been vaccinated. We don't know what impact that has on transmission quite yet. We do know it reduces transmission somewhat, but we don't know to what extent. So if you have any staff that have had the first or even the second vaccine, then they still need to LFD test. And if they are close contacts of people, they still need to self-isolate. At this time, obviously, in your settings, if you have a case within the group, you generally isolate the entire group. But please, as always, keep an eye on any areas in which staff cross, any areas in which there could be sort of overlapping between children in settings or mixing of objects. But I think ultimately that declining cases is a sign that all of the settings have tightened a lot of their guidance and really separated their groups out and done even more to sort of batten down the hatches, preventing further cases. So I think that's a really good sign. In our earlier settings, they've been dipping because we have been doing a lot more around testing, around supporting settings, and around settings doing a lot more to prevent cases coming in, and even parents being aware a lot more and testing a lot more. So that's good to see that the cases are coming down. So that's everything I've got on sort of some of the test kits. I do know that some of you have already received your LFD test kits. And although the guidance is that, you shouldn't start testing until the 22nd, we think that this guidance is for a couple of reasons. One is that they want you to have enough test kits so that you got enough from the 22nd onwards, and they've got the supply chain arranged for that. And I think it's also so that all of the settings feel that they're all on the same foot, that some settings aren't ahead of others. So I think that's the reason why they don't want people to test until the 22nd. But regardless, it's good that we've all got the home test kits now. If you've got any staff anyway that have children of school age, they and their bubbles, their support bubbles, their wider family, not just your staff, but their wider family, can use those test kits as well. So they can go and collect those Lfd devices from any PCR walkthrough site, and they can collect those from there. So your staff will probably get enough to cover. Sorry, as a setting, you'll get enough to cover your staff. But if the staff want to test their children, or a grandmother that lives at home, or their husbands, then they can go to the PCR walkthrough centres between 1 PM and 8 PM and collect the test kits. Also, I'll put the link in here on how to order that via Royal Mail. So there's those ways. So I'll just jump onto the chat box now. I do appreciate that I've rattled through that quite quickly. We have staff who were previously tested positive. Is it still guidance that LFT and LFDs not to be used for 90 days after a positive PCR? So that is the guidance in schools. Unfortunately, for earlier settings, the DfE are quite clear that they do want you to LFD and LFT test. So even if you have had staff who have tested positive by PCR, then they should be jumping on board the LFD and the LFT testing. Ultimately, there isn't a problem with that, and we're not finding that because they've tested positive previously that creates them to test positive again by LFD or LFT. I would say that they should be exempt from PCR testing again, though, within the 90 days. Can staff test once a week? Yes, so you can go and use your local test centres as much as you like. Regarding the test kits that you get for your staff, you may only have a certain number to maybe test them twice a week. If they want to test more than that themselves, then just send them along to the, if they've got children of school age, then they can send them along to the PCR walk-in sites to collect tests that way. or they can go via the local test centres and get tested there. So you've got a couple of options. If you want staff to test and they haven't got enough LFDs, they can go to the LFT centres. It all depends on how many kits that you get. Anyone that got children of school age can go and collect the kits as well. Or if they're part of a support bubble, that support bubble can collect the LFD test kits for them as well. So follow the guidance for the test kits. Are the kits of 7? We have received LFTs. Sorry, I was late joining. So the LFDs are the little cartridge packs. You get a pack of 7. The LFTs are packs of 25. They don't come with a plastic cartridge. They're literally a whole test tube set. So you wouldn't get the same setup if you were at an LFT centre. So you get packs of 7 LFDs. The email from DFE said that you would be a link to say you hadn't received enough LFD tests available from the 15th, but I can't find this link. Could someone post it in the chat, please? We'll have to have a look into that after the call. We haven't had the guidance yet to tell us how to use the kits. Do you know how we get this? We also haven't had enough kits for the staff. Do you know how we order some more? So in your test kits should be the full instructions on how to do that. I'll just pull one out for you so you can see. So in your kit you get a little bag of like single serve droplets. You get a box which has got a hole in it to put your little cap for your swab. You get a packet of swabs, and then you get this little like a pregnancy test kit. Inside that is a tiny little plastic cartridge. Just find the one that I've opened. So I'll just open this one for you. So here's the swabs, and then in the test kit you get this tiny little like plastic cartridge on here. So you put your swab into the little plastic vial. You do your swab, put it into a vial, and then that gets dropped onto the test kit, and then you get the result from that. So this is the Lfd devices. So so this is what you'll be using in at home going forward, and this is what we'll be using. So it's a bit like literally like a pregnancy test kit if you've ever done one. You get 2 lines if it's positive. Even if it's a really faint double line, you should go for a PCR test just to confirm that it is or isn't positive. So it's literally a tiny little plastic device, which is different to what you use at the test centres. So regarding the test kits, they should be out imminently. I think part of the reason why they're saying don't start until the 22nd is because lots of people won't have their test kits by then. In the whole box comes like a load of instructions on how to do the test and how to register it online. And as a setting, you should be registering all of your tests online. If people do get them as part of their school package, which is what the ones that I've got, it's the guidance on how to register your results. But yeah, it's just really interesting. Can setting managers go and pick up kits from PCR centres if needed rather than go post them out? If they are part of a school, so as in if they've got, these are for families of school age children. No one's obviously checking names or whether the name of your child or anything like that. But you should have enough test kits for your staff. There should be enough for you to be able to test your staff twice weekly. How often they should be used? They should be for twice weekly is what the numbers are. You should be testing definitely twice weekly. Please see the email above with link to the further guidance. So yeah, I think a lot of these questions are answered in that guidance, which is attached in the. So if you have any more queries, do email us, the team at Early Years Advisors. But everything that you're asking about is literally in that snippet of guidance. Staff who've had the COVID jab still need to LFD. Yes, so anyone who's had the jab still needs to continue to LFD test. Yep, so you haven't been sent through anything yet. It should be coming imminently, and I mean, I don't know what the number is to chase because I think they're all coming from DFE. I'm sure the DFE helpline of 119 can help you out if you haven't had them yet, but they should be with you, I guess, in the next few days. And if they're not, then the staff can continue to use the LFT test community centre centres for the time being, once or twice a week. That's still available to you, and anyone with children of school age can go and collect their test kits from the PCR walkthrough centres. But like I say, no one's checking, you know, where they've come, you know, the families, or ask you anything. They don't even ask your name. You just pick up your big box of test kits. Okay, I think that's answered all of those. Sorry, I am speaking very quickly. I don't mean to. Does anyone want to unmute? If you, obviously there's lots of people on this conversation who don't have the chat option. So if anyone wants to unmute and ask a question, feel free to. Is it mandatory? No, it's all done on goodwill. If we test as many people as possible, then we can catch outbreaks sooner, because what happens is a couple of people will have it asymptomatically, and then a couple of people have it asymptomatically, and then it will spread to someone who's got symptoms, but by then it's probably passed on to others. So no, they don't have to do it. We can't force them to do it. And the same as vaccine, we can't force anyone to have the vaccine or go for the vaccine. It's just based on goodwill and what's good for preventing transmission. We've had a large box of masks delivered today. Has anyone else? So we have been sending face coverings to a number, as a council has sent a number of face coverings to various settings. So I think all of you have had a supply of face coverings from the council to use as and when you need it. So that's likely that the stash of face coverings that have come from the council today. If anyone wants to unmute. Yes, we received masks today, much appreciated.
Yeah, and can I just ask, I know that the home testing is it meant to be done, can they do it once a week, or do they have to do it twice a week, the home, the LFDs?
It's recommended twice a week. The reason being is that the infection goes through a bell curve. So on day one, you may not be picked up. It's a bit like, you know, the pregnancy hormones. So on day one, you might not be picked up, then it goes to a peak and then it comes down again. And if you test in the 3 to 5 day gap, then you can pick up somebody. So if you test once and then twice in that period of every 3 to 5 days, you're more likely to pick people up while they're infectious, and it's readable on the LFDs, because these pick up those that have got the higher infectivity, the higher doses of virus in the nose, basically. So we recommend twice a week, but people aren't. You don't have to do it. You don't legally have to test at all. At a minimum, we would say once a week, but ideally twice a week, but we can't force anyone to test. And it's also maturing your offer. So you may get into a routine of doing things, of doing it once a week, and then you get into a routine of doing it twice a week, or maybe it doesn't work for you at all. But we would like you to test twice a week so we can pick up as many people in that infectious period as possible. Thank you for that question. We can still pick up some if needed, but worse places haven't. Oh, I think that might be another chapter in the meeting, sorry. Anyone else want to unmute and ask a question? I do feel that I've gone through that very, very quickly. If there's anything that I haven't covered in detail, please do just drop me an email or drop the team an email. I can go over it again. Just to clarify, if someone has tested positive for COVID before, will it show on the LFD test and cause unnecessary? No. So if you've tested positive for COVID by PCR, PCR is based on the genetic material it tests for genetics. If you do the LFD test, it picks up live virus in the nose. So the PCR test is very, very sensitive. It picks up the genetic material is in your nose, but that genetic material may be dead. So the PCR testing picks up live and dead virus. So that's why we say to people, if you've tested positive for COVID in the last 90 days, unless you've developed symptoms again recently, please don't test again, because we can pick up that dead virus for 90 days. However, LFD devices, LFT tests and LFDs, the devices, only pick up the live virus, but like a wilting flower, it won't bond to the dead flower. It'll only bond to the live flower. So you're more likely to pick up virus in these devices that are live and infectious, and it's not going to have that echo of the old positives. So even if you've tested positive for by PCR, you can LFT or LFD, however you wish to test after that, and DFE are recommending that. The only problem is that it's wasteful to some degree. So we're saying that for 90 days, you don't have to because it's wasteful. But as a setting, your settings are ruled under DfE differently to schools. So you must continue the LFT testing, but it won't pick up echoes of positive cases. Someone else ask a question. I think someone's got their hand up.
Yeah, it's me, Leanne Natalie.
Yeah.
Hiya. Can I just double check if I've got, is it still the same as before? So if I've got a member of staff that tests on a Monday morning and it's showing positive, it's still the 48 hours before. So it actually would be the Saturday, Sunday and Saturday taken into account and wouldn't affect the preschool from the Friday.
That's right. So but it's always worth double checking. Are you sure you weren't unwell with any symptom? Like, did you have any headaches or throat? But yes, if they just did the test because it was part of the mandated process, sorry, not mandated, but the process we're doing, then yes, you count the 2 days before. So the Saturday, the Sunday, they weren't in the setting, obviously on those days. So you're right, you just go from those days, which is the Monday if they were in, or if they weren't in, there's no action in the setting at all. So yes, we use the 2 days before. So Monday morning tests mean that you wouldn't be picking up people who were impacting the Friday groupings.
Okay, thank you.
Yeah, I think that explains it. I feel like I'm mumbling a lot more today than usual. I'm sorry, I do apologise. Anyone else? Any more questions? No? Okay. Well, as always, yes, as always, if you have any more queries, please email the early years advisors who can pass those queries on to me and we can give some more answers. And if not, then we'll see you at the same time next week. So thank you very much, everybody, for coming.